Now we know. A lot of what they told us just wasn't backed by science, and some people are still lying about it. I've got Dr. Jesse Lopez, who's going to talk to us about getting the multiple shots because of the pandemic, what it's really doing to our bodies. This is an interview you can't miss. You have been the person who put his license on the line to say, I want you to know what you're taking. I want to know what these shots or what this medication that you're ingesting will do to you. And because of that, they did all they could to stop you, and I'm glad they couldn't stop you. When you hear people say, impeach Bobby Kennedy Jr., get him off of HHS, he doesn't have any idea what he's talking about, he's not going with the science. What is your response to that?
Well, those are usually the ones with a vested interest in getting him out, meaning that they have ties to the pharmaceutical industry. And as long as he stays in there, they're going to end up losing money because he is starting to take a stand to make changes based on some of the horrific things that you and I discussed in the past during the height of the pandemic, things that I've shared with you about in terms of adverse effects to these gene therapies or mRNA vaccines that were not known. And when they were known, they were not shared with the public or the physicians who were recommending these to the patients.
So you guys were being told, this is what it does, this is what you say, and if you ask questions, which you did, and some other doctors did as well, but you were in the minority, you weren't getting any answers. They wouldn't come back and say, well, here's what's in it, here's what it does, here's what our testing shows. Was there even testing done before they released this thing?
Their testing was inadequately done. They even claimed that themselves because they said that they did it at the speed of science when they were called out that this was not a sterilizing vaccine, that this did not prevent the disease process from happening. And just to clarify that point, during my previous discussions with you on previous shows, I would bring up data showing you the beginnings of this unraveling. For instance, back in 2023, around May 17th, the study came out that you and I talked about on your show, where I spoke about individuals who were getting these boosters over and over on top of one another were actually individuals who were ending up more ill. The study supported that these patients were developing an IgG4 antibody that was a non-neutralizing antibody that actually made them more susceptible. Now, just a quick preface, people want to know, well, how does that make them more susceptible? It's very similar to if you go to an allergist or a dermatologist, and they give you a little bit of an antigen to get you used to some cottonwood floating off the tree.
Right.
Your immune system sees it, but it says, oh, you're okay, I'm just going to go back to sleep. That's kind of what IgG4 antibodies are like. So what happens, though, it's doing this in the face of a virulent disease process, a nasty virus. So then it has free license to wreak havoc on your body. So we tried to warn clinicians about this, that it is not appropriate to do the vaccine after the vaccine, especially if the individual has had COVID, and then you give them a vaccine within the 20 days of them being ill, a vaccine that's dangerous. Well, I want to know that in 2025, we're vindicated once more because now another study came out of Spain with 446 healthcare workers showing the very same thing. Not only to that, but the potentiality that the immune system is so adversely affected that it could put them at an increased risk for autoimmune disorders or even cancer. So these types of things have reared their ugly heads back then and now. And Secretary Kennedy and the new FDA commissioners are trying to make a stand so that this doesn't happen again in the future. And that's what we need.
Jesse, let me stop you there. Back then, they didn't tell us. Now, at least, we're learning about it and we're finding out. If we can make it layman's terms, and by the way, it's inspiration.health. Go and check him out. He puts all this stuff on his website. It's Dr. Jesse Lopez. He also does telehealth, so go and check him out that way, too, inspiration.health. I just want to make sure that I understand in my very small brain. What you're saying is your immune system tolerates it, allows it. Almost does your immune system assume that that's part of the natural flow and don't worry about it, that's not an issue anymore? Is that what I'm getting from you?
Yeah, it produces an antibody that is non-neutralizing as opposed to an IgG1 or IgG3 antibody that really attacks and gets the cascade going to get rid of it. So what happens is that even the smallest virus can become a more significant virus. As a matter of fact, you may have heard, Joe, some scientists talking about a vaccine-induced AIDS type of situation.
Yes.
And so what that simply is a compromise of the immune system, and the immune system is not able to fight anything off. And so it's a real entity. It's a real potential problem. And,
Is it? Is it? Hold on, because again, dumb guy here. Keep that in mind.
no,
Is it the immune system not able to fight it off, or does the immune system say this isn't something we should fight? Are we telling the immune system this is no big deal, or are we telling, or is the immune system damaged, or is that the same thing?
it's kind of the same thing. It's damage because it's not recognizing that it's something serious that
Gotcha.
it should, 100% to get rid of it out of the body, attack at full force. It's allowing it to be present, and then it is able to replicate in such a way that it then overwhelms the body's defenses. The body then may be able to come around and eventually fight it off, but as soon as that individual recovers, they're right back into another throw of another viral illness 7, 10 days, 14 days later. This is a phenomenon that's been known for a long time with vaccines. With the pertussis vaccine, for instance, or with the malaria vaccine, when they're getting it over and over again repetitively, this has been shown to happen. This may even be why stacking a heavy immunization schedule on top of children, these children are actually sick all the time.
Right.
They're always sick. They get all the vaccines, they follow the schedule, but they're still always sick because that very thing is happening to their immune system. So some of this is being looked at by the new FDA, by the new commissioners, and even that was one of the premises in Dr. Vinny Prasad's discussion and memo that he sent out in terms of this heavy-weighted schedule upon children.
It is Dr. Jesse Lopez, Inspiration.Health. Any thoughts on Dr. Bhattacharya and Dr. Makari and of course, Dr. Oz? I mean, RFK Jr. is not a doctor, but he's somebody who's learned enough about vaccines that he's very intelligent when it comes to that. But he's surrounding himself with people who I think are really good. Are you fans of these people too?
100%. I was listening to some of their testimony and discussions, and a lot of this was centered around, and subsequently, I think, is what led to the production of a memo that came from Dr. Prasad on November 28th, where basically he laid a new framework for the FDA. As you know, or maybe your audience doesn't know, he's the new director for the Center of Biologics Evaluation and
Right.
Research. And he replaced Dr. Peter Mark's position. And Dr. Peter Mark is the one, who green lighted every single vaccine that came through, which is something we're going to talk about here in a minute.
Okay.
But what's been significant is that they've all joined forces in some very significant things that they want to change. So, for instance, in this memo that went out, I think as a result of this collaboration, is that they want to require all new vaccines that come out to have a pre-market randomized clinical trial approach before they're brought to market. This is really important because the way that some vaccines are evaluated is that they're evaluated against other vaccines or other medications. They're not addressed or assessed against a true placebo. So they want this to be a true placebo, double-blinded, randomized type of approach for vaccines in the future. That's good science, right, in and of
Yeah.
itself. But here's what's really critical, and I think this is what is not liked by the old guard of the FDA, and that is that they want to do away with this process called immunobridging. Have you ever heard of that,
I
Joe?
have not. What is that?
Well, immunobridging is when it infers vaccine efficacy or the effectiveness of the vaccine from laboratory tests or other data, rather than through the assessment of real world reductions in disease or death. So that's really important because under the Biden administration expanded the COVID vaccines to children using this immunobridging technique. In other words, they extrapolated the vaccine data and efficacy information from adults to children. That's actually how they came up with the dosing for the children. It wasn't because they set up these randomized trials, it was just extrapolated. Well, we've got the adults, let's try this with the kids. Now let's do it on the kids and see how it works. And then we'll follow the kids and see what happens.
And by the
Well,
way, you've been saying since day one that the kids didn't even have it. It was unnecessary to give it to any children. It was unnecessary, it turns out, to give it to anybody. But to give it to children made no sense at all because they would get it and COVID would be gone. They were not at high risk. Go ahead.
right. The own FDA data at that time said the risk of mortality was 0.003%. Let's not
Right.
forget that. That's their
Right.
own data. But that's when you say hello myocarditis. When you don't have the proper type of study done, then these kinds of safety issues develop because it hasn't been thoroughly vetted. So that's when you started to see young people develop significant myocarditis and sudden death, and children that are 12 and 13 and 14 years old getting myocarditis. So this is a really important aspect of it. In addition, the FDA commissioners are looking at not granting market authorization to vaccines in pregnant women just based on unproven, what we call surrogate endpoints. And what that is, it means that they're not going to approve the medication or the vaccine just because of indirect or shortcut measures that suggest benefit. It has to actually be proven to show real safety or effectiveness. So this inferring and saying that we've studied it and call it that is no longer going to fly.
Good.
Well, guess what? The pharmacy industry hates that. So guess
Of
who
course they
reared their
do.
ugly head? Guess who reared their ugly head over this?
Who? Merck?
Uh,
Pfizer?
well, who?
Pfizer? Merck? Who?
Yeah, well, pretty much all the above through their surrogates. So 12 former FDA commissioners, Joe, put together a letter and sent it to the New England Journal of Medicine.
Wow.
And this was published on December 5th, this month, 2025. And they entitled it A Threat to Evidence-Based Vaccine Policy and Public Health Security at the FDA. Basically, these FDA former commissioners under both types of administration, Republican and Democrat, were stating that this was going to cause, death and despair. And what's interesting is that they were stating this is, number one, it's going to hamper the market. Okay, well, who cares? I don't care about the market. I care about my patients.
Right.
And they quoted specifically stating that their words, insisting on long, expensive outcome studies for every updated formulation would delay the arrival of better matched vaccines. Now, that doesn't even make sense to me because if you're doing a study properly and it's long and it's expensive, you're going to have good data. You're not going to have
but Jesse, you know why they did that, right? You've been in the game long enough. You know why they did that. They did that so that people like Elizabeth Warren can sit in her perch in the Senate and say, "Look at this letter that was sent to the New England Journal of Medicine, and everybody's going to die if we don't get a bunch of vaccinations." Of course, she got $800,000, in her campaign from the pharmaceutical company. So people that's why they're doing it, right? I mean, there's no science behind what they're saying. If I understood what you said, they're inferring something on children that they were extrapolating from adults, and they can't do that. There was no testing done. So they're actually arguing for kids to get doses of vaccines that haven't been studied at all, and certainly didn't have the double-blind placebo thing you were talking about. I mean, that's the reason why, right? So that the House and Senate will now hold RFK Jr. in front of them and say, "You're anti-vaccine, you want to kill kids."
Yeah, you're exactly right. So CNN is going to show that clip of Elizabeth Warren or whoever decides to be the chump of the moment, and they're going to take a snippet of them saying that and put them on news stations all across the country.
Right.
But guess what those news stations aren't telling you? They aren't telling you that the ethical disclosure that these commissioners had to give to the New England Journal of Medicine was their financial tie-ins with the pharmaceutical industry.
Oh.
So they have to tell that to the journal.
That's
right?
available?
That's available. Oh, yeah. So, for instance, Scott Gottlieb, he got $2.4 million, $1 million, in cash and stock from his position as from the Pfizer board of directors when he was on the board of directors. He signed that letter. Mike McClellan, he received $3.3 million from Johnson & Johnson as a member of the board of directors. He signed that letter.
No way. He signed the letter, Jesse? No way. Go ahead. Go ahead. I want to hear some more.
So, well, I'll tell you what, it just gets even richer and richer. There's Mark Hamburg. He earned $2.8 million.
Of course.
He's on the member of a board of Analem Pharmaceuticals. They deal in mRNA technology.
So pharmaceutical company executives, people who are on the board, who used to be FDA directors or workers, they're sending a letter to the New England Journal of Medicine saying that the companies that are enriching them need to have their products in our kids' arms, and we're supposed to just believe them and think that it's just good science, Jesse. Listen, I'm so glad that you're exposing this. I want to go back to something you said earlier. By the way, Jesse Lopez, Dr. Jesse Lopez, go to inspiration.health. He does telemedicine. Go check out all these articles are up on his website, inspiration.health. Go there now. I want to go back to what you said earlier. Okay, so our immune system is either damaged, not mine because I didn't take any vaccinations, but either they're tolerating what they shouldn't tolerate or they're damaged. Can we reverse that? Is there a way to reboost or rebolster our immune system to understand that stuff, the spike protein garbage in your system, is bad? Go attack it.
Well, the first thing that you have to stop doing is doing the repetitive boosters and vaccines every 3 months.
So don't get the 18th booster?
So yeah, don't go get the 18th booster. Give your immune system a chance to, number one, recover.
Okay.
Number two, really, that's the $1 million question. Are we able to help patients completely detox? We believe that we can. We don't know if it's permanent. I've had patients where I've assisted them with that who have had COVID vaccine injury as well as COVID long haul. We've utilized medications that tie up the spike protein that enhance the cells to be able to come back to life, so to speak, to improve mitochondrial function, decrease antihistamine response. So there have been novel approaches that we have utilized. Most of them are anecdotal, but after you accumulate a significant amount of data in clinical trial, just like we were utilizing with some of the patients during COVID, and they're getting better, then you say, hey, I have this armamentarium and it's working and it's getting people better, so let's keep doing it. The question is, once you stop that therapy, are they good forever or are they not? That
Right.
remains to be seen.
It is Dr. Jesse Lopez, Inspiration.Health. Doc, I've got less than 2 minutes, maybe a minute and a half. But I don't want to not ask you about GLP-1s. Everybody appears to be taking GLP-1s now. I mean, from the famous to the guy on the street, everybody is shedding a bunch of weight. Looks like it's great. Looks like it's healthy. Are there adverse effects that we should worry about? Or has this been thoroughly studied that it's safe for humans? Because, again, everybody's losing a bunch of weight. Happy days are here again. What do you know about these?
Well, it's something that I use extensively in my practice. I do medical and surgical weight loss. I'm a surgeon, bariatric surgeon, and also a general surgeon. And so we use this to help patients bridge between surgery, after surgery, before surgery, patients that don't need the surgery but need to lose 30, 40, 50 pounds. They are good medications if they are used properly with someone who knows what they're doing. What's happening
Okay.
is that individuals are going and getting it off some unknown website. They're
Yeah.
not getting good direction on proper
They're offered
nutrition.
everywhere. You can literally go anywhere and get a quick prescription online and just get it. And are they not sure how to use it right? Is that what we're talking about?
Well, the biggest thing is that they're not taught how to eat when they diet. And
Okay.
that is that they have to have protein, protein, protein. I know you work out, I work out, we're trying to get in 150 grams of protein a day.
Yes.
These patients have to get in at least a minimum of 80 grams of protein a day, but they're not getting that guidance on what to eat and how to eat. So they end up losing muscle mass as well as body fat.
Is that
And
why
so
they're getting that Ozempic face? You see their face muscles are
100%.
like they're all sunken in. I mean, again, they feel better, they look better, but they're not eating because I probably do 200 to 250 grams of protein a day.
I bet you do. Yeah.
You have to try to, or else at our age the muscle goes away. So these people are not getting. So what are they getting? They're getting it through the mail, Jesse, and nobody who sends them the prescription is saying this is the diet you must follow, or else you're going to lose your muscle mass.
Yeah, they really don't have that accountability. So our patients will have to typically come into us face to face, or we'll see them for an initial consultation. If we do any telemedicine, I then see them face to face. I can see what's going on. We have them send us their vitals and what's going on with their weight. We look at their BMI. We have them use a wonderful tool called the Renfo scale, so they can get on and send me the data on their percent body fat, their percent muscle mass.
But
Their
Jesse, you
percent
realize the
body
BMI
water.
sucks, right? I mean, the BMI says
BMI
I'm
is horrible.
obese.
Absolutely,
Yeah,
100%. I
right,
mean, you could have a huge BMI, but you're a muscular football player.
right.
But we take all those parameters and look at all of them
Okay,
in terms of the patient, right? And so, really, a scale that really gives you the conduction where you can look at percent body fat, percent muscle mass, that's really the way to go, because then you can really start to see if they're losing too much muscle protein, or if they're losing real body fat. And then the thing is that you also have to have a physician that's ready to say, no,
What,
you
what, what
can't.
does
Yeah,
what does Ozempic do? What does it literally do? Why would I
so
lose body fat if I'm taking enough protein and I'm eating the way that Dr. Jesse says eat? What does the GLP-1 actually do? Does it speed up your metabolism? What does it do?
Yeah, so they actually increase the body's metabolism by actually increasing your insulin production. And
Okay,
so by doing that, it actually forces through a bunch of biochemical processes the actual breakdown of the fat so that the patient can sit in a chair and lose weight. So I don't like it from that perspective because I want my patients
right.
to exercise. But it also slows down the GI tract. By slowing down the GI tract, the patient stays satisfied longer,
Okay,
so they're not as hungry. But therein lies why a lot of patients end up with some nausea or constipation with these
right.
medicines is because of that mechanism of action. But it's an effective tool if it's used correctly. by the right physician who's taking care of the patient and looking out for their interest and not just trying to make a buck.
Yeah, no, that makes sense. Inspiration.health. Go there and check out everything he does. He also does telemedicine. It's Dr. Jesse Lopez. Jesse, I appreciate your friendship. Thanks for all the information that you give us every time you come on. Have an incredible Christmas and a Happy New Year.
Thank
Thanks,
you.
brother.
Thank you. To you too, my brother. Appreciate it.